Since the final phase of the nursing process is evaluation, we will look at evaluation questions last. Remember that during the evaluation phase, the nurse must determine the extent to which goals have been achieved. Therefore, evaluation questions require you to compare specific outcomes with expected outcomes. Nursing behaviors associated with evaluation may also include determining the impact of a nursing action, verifying that tests or procedures were performed accurately, or evaluating client understanding of information given. So when answering evaluation questions, keep in mind that they may ask the nurse to determine if progress or learning has occurred, or what an appropriate action would be based on the client's response. Some evaluation questions may have false response stems that require an answering indicating, for example, that the client needs more teaching or that a nursing procedure was done incorrectly. Always remember that your evaluation must relate to the issue of the question. When answering evaluation questions, keep in mind evaluation questions often have false response stems that require an answer indicating, for example, that the client needs more teaching or that a nursing procedure was done incorrectly. Also, always consider the rationale or the purpose of the care being evaluated, and that this must relate to the issue of the question. So be certain to focus on the issue of the question. Let's look at an example of an evaluation question. Let's first separate the case scenario from the stem of the question. The case scenario tells us the nurse is caring for a client recovering from a craniotomy for a pituitary tumor who has developed diabetes insipidus and evaluate the client's response to vasopressin. The stem of the question asks, which finding indicates the desired response to the medication? A decreased. Let's identify those critical elements. The key words include desired response and decreased. The client is the client who is recovering from a craniotomy for a pituitary tumor. The issue is desired response to vasopressin. The type of stem is a true response stem. Let's go ahead and look at and eliminate distractors. Option 1, urine output values will be assigned a plus sign. DI is caused by the inability of the kidneys to conserve water as they perform their function of filtering blood, which leads to greatly increased urination. The amount of water conserved is controlled by ADH. Endogenous ADH, or vasopressin, is used to control the loss of water associated with DI. Therefore, after administering vasopressin, the nurse should expect to assess a decreased urinary output. Blood sugar levels, option 2. This will be assigned a minus sign. Did you confuse DI with diabetes mellitus? Diabetes mellitus, a condition of the pancreas, is associated with increased serum blood sugars, not DI, a condition of the pituitary gland. Option 3, specific gravity values. This will receive a minus sign. You are correct that the urine-specific gravity value will help the nurse to evaluate the client's fluid volume status. However, a greatly decreased specific gravity is typically seen in the client with DI. Treatment with vasopressin should lead to an increase in the specific gravity as the client is better able to concentrate their urine. In option 4, blood pressure values. This will receive a minus sign. You are correct that blood pressure value will help the nurse to evaluate the client's fluid volume status. However, a drop in the blood pressure is often seen in the client with DI due to extreme fluid loss. Treatment with vasopressin should lead to an increase or a return to normal blood pressure as the client stops excreting excessive fluids. Because we have 3 probably wrong answers and 1 probably right answer in choice 1, we will go with what we know and choose 1, urine output values, as the correct answer. Let's summarize where we are.